you. Hello everyone, it's a great pleasure to be here in Egypt. I'm really honored to be part of this session, and I'm really honored to have that connective session between the Balkan Venous Forum and the Egyptian Venous Forum. I have no disclosures. So I was happy when Professor Fakri invited me to say a few words about the surgical interventions for Great Saphenous vein in venous leg ulcers patients, because we have a lot of venous leg ulcers patients in Balkans. We see very often these kind of cases. Of course, when we are talking about venous leg ulcers, we have the conservative and the surgical methods, but I have to speak about the surgical methods. So, we have even a study conducted in Egypt, which claimed that surgery and radiofrequency ablation are highly effective, both resulting in a significant decrease in venous ulcer size. Also, radiofrequency seems to be less time-consuming than stripping in terms of surgical time and hospital stay. Also, we have a study claiming that the treatment of the full-length Great Saphenous vein with a single non-thermal modality or thermal modality plus MFA below the knee have comparable times to wound healing. Of course, irrespective of modality, the entire Great Saphenous vein to the ankle is preferred to be treated. So it's more the strategy than the method. But also, when you're talking about venous ulcers, it's very important to consider the etiology of the venous ulcer, which in most of the cases is related to the reflux on the perforator vein. So how do we treat the perforators? Of course, you have many modalities like percutaneous thermal ablation, subfascial endoscopic perforator surgery, open surgery, or sclerotherapy. The most recent multi-society guidelines recommend the percutaneous techniques, and most of them are pro-foam sclerotherapy in such cases. Combining Great Saphenous veins ablation with foam sclerotherapy of pathological perforating veins can improve healing outcomes, and also at 1 month sub-ulcer foam sclerotherapy and compression therapy reduce the ulcer area statistically significant. But we also have some precautions. We have in here a study that suggests that removal of the Great Saphenous vein through stripping or ablating Great Saphenous vein in patients with post-thrombotic deep venous system affecting the femoropopliteal segment may result in a delayed ulcer healing and increased ulcer recurrence. And also this study claimed that patients with an intact Great Saphenous vein had a better outcomes even when refluxing Great Saphenous vein was left untreated. Also, an important precaution is in regard with the mixed ulcers. But even in mixed ulcers, we have enough literature data which support compression therapy. Compression therapy seems to be safe and effective for mixed ulcers when the ABPA is more than 0.5. And inelastic short stretch bandages are preferred to increase venous return without restricting arterial flow. And we have to acknowledge that Egyptians are the master of bandaging. Of course, I'm not here to talk only about guidelines. I'm here to share a little bit the way I do things. And considering that in Romania, only open surgery is reimbursed by the health insurance, and we have to acknowledge the fact that most of the patients with venous ulcers are from low social conditions, so they cannot afford a treatment in a private clinic. I still do a lot of open surgeries for such patients. Of course, in the private clinic, I do foam sclerotherapy for perforated veins, ultrasound guided, but there are only a few patients. Most of them are treated in the hospital by open surgery, and we have good results, as we can see in these images, even with open surgeries. But not to forget, in all these patients, I use compression therapy. So, regarding my precautions, I have to highlight 2 aspects. In mixed ulcers, I'm a little bit concerned in applying compression therapy. So I prefer not to put compression if the ABI is below 0.8. Also, we know that many of the venous ulcers are infected, and in infected wounds, I'm quite cautious in doing surgery. So first of all, I'm practicing wound debridement. I treat the patients for the infection, and then I perform the surgery. In the end of the presentation, I would like to say that Egypt is a wonderful country, and even the poetry talks about the beauty of Egypt. And you see in these pictures, with us around the world, you see Professor Ayman Fakri, you see Professor Tarek, you see Professor Walid, you see Professor Ahmad Hussein, you see Sohail, and of course the Balkan part of this meeting, you see me, you see Mervat and Alina. This is not just a friendship, it's more than that. This is the Egyptian side of me. These were yesterday in the Royal Vascular Clinic. This is the Three Musketeers. This is me with Professor Hussein in this morning. And this is the sign of Egyptian Venous Forum. This is not a friendship, this is a brotherhood. So now it will be my turn to be your host. You are a wonderful host here in Egypt. So it will be my turn in October to be your host. So I'm inviting you to the 16th Congress of the Balkan Venous Forum, which is part of the Leg Gathering Global Project. We have many important guests in here, and I will be honored to have you as guest also. It will take place from 14 to 17 of October in Timișoara, Romania. So thank you for your attention, and I'm looking forward to take forward this friendship, this brotherhood, and this scientific collaboration. Thank you.